Calling the next chairpersons, Dr. Harmeet Singh, former professor in HOD Orthopedics at DDU Hospital, New Delhi, and the present secretary of Indian Association of Age Management, and Dr. Amandeep Singh Narang, senior consultant, joint replacement orthopedician and traumatologist, New Delhi. Sir, please. Our next talk is a new, yet evolving, yet exciting concept. It is a concept which is defined as inflammageing. I'm not going to talk much about it because we have a speaker for that. But it is a concept that it is upcoming and it's evolving, and we all need to understand it in the relevance of aging. Our speaker is the director of Harish Chandra Orthopedic Research Institute from Patna, Bihar, and the founding president of the Indian Rheumatology Association. He has held various posts in the orthopedic world. Please welcome Dr. S.S. Jha for his talk on inflammageing.
Welcome Dr. S.S. Jha on this very good day today. It is Baisakhi today. My speaker is from Patna Sahib. Let us have some words of wisdom and advice.
तो यहाँ वहाँ लेके आइए ना,
यहाँ से इससे चलेगा ये,
चलाइए ना,
ये इससे
ऑन करो ना
सर। ये वहाँ पे होना है, पेंटर दीजिए, मैं यहाँ पे कर देता हूँ।
हाँ क्या करते हो आप? वहाँ करने से क्या फायदा? Well, friends, good afternoon, and respected chairman, Sat Sri Akal. You have talked of Patna Sahib. Yes, I bring greetings and blessings from Patna and Patna Sahib. Well, step by step, we have been moving from one specialty to the other specialty. And I myself, when was stepping up onto the dais, it was my knees which were hurting. Osteoarthritis literally is a very common accompaniment of geriatric population. Well, talking of osteoarthritis, this was one disease about which I would like to talk very briefly. There was a conception, I would say a misconception, that osteoarthritis is a result of degeneration in the body. The articular surface degenerates. It's not a simple degeneration, friends. It was as early as 2000 and even before in 1990s that we could understand, because of progress in molecular biology, that the genesis of osteoarthritis is hidden in inflammation. So this inflammatory theory was propounded in 1990 and many soluble mediators were discovered. I will not like to go into the details. So it is now a matter of certainty, and it was realized in 2020 and maybe even later that yes, inflammation definitely is a contributor in osteoarthritis. Well, coming to the topic of aging, there are 12 basic hallmarks of aging. 9 are little clumsy sounding words, but the 3 additions that have taken place in 2023 are disabled microautophagy, second one is chronic inflammation, and the third one is age-associated dysbiosis. Friends, all of us by now are aware that bacteria inside our gut have their influence in many diseases. In Ayurveda, we used to say it is lungs, bowel, and joints which are responsible for so many diseases. So bowels, the bacteria have relationship. So if these bacteria are abnormally behaving, known as dysbiosis, maybe they produce changes like osteoarthritis, like osteoporosis, even rheumatoid arthritis is there. So the topic of discussion is inflammageing, and this word has already been coined by Dr. Suresh, also by Dr. O.P. Sharma, that aging, as it progresses, there are lifestyle changes, pollution, chronic ailments, and medication. And these are what triggers low-grade inflammation, which is characterized by oxidative stress. Now, what are the risk factors for evolution of inflammaging? They are metabolic factors. It has already been coined several times earlier. High blood pressure, impaired fasting glucose, abdominal obesity, high triglyceride levels, low HDL cholesterol level, they all trigger low-grade inflammation. Well, when inflammaging sets in, what is the trigger? The trigger is that the body wants to attempt to remove the damaged cells, the debris, the irritants, the pathogens, and these foreplay of inflammation that results into so many systemic effects, in which you will find a young person who had good hemoglobin, now when he is around 80, he has become anemic. There is osteoporosis, there is sarcopenia, neurogenesis, insulin resistance is there, mitochondrial function and biogenesis also is there. So, finally, as a resultant effect, when the inflammation gets eliminated, it switches off the inflammation and healing ensues. So, the $1,000,000 question is, if we understand this pathomechanics of inflammaging, and if we can stop or switch off this inflammation, maybe our body is healed. So, when did this terminology inflammageing was coined? It was only in 2000 that it was coined by Francesi, and it said aging process has chronic, progressive, pro-inflammatory phenotypes. I will not go into the various elevated levels of inflammatory markers. Well, this is a very vital one, and it tells us that what leads to inflammaging. Number one, you will find labeled on the left side, is the genetic predisposition, which becomes so very important. Then friends, we all will realize, and it has already been said by Dr. Suresh, that obesity is a common accompaniment when we become elderly. And when such a patient comes and tells me, "Doctor, I have become obese," I laughingly would say that you look like a mother-in-law. Unless you are obese, your daughter-in-law will not give you that much of respect. But conversely, this has many deleterious effects, and you will find that there is visceral fat tissue which is infiltrated by B cells and T cells and macrophages. Then there is adipocyte pro-inflammatory phenotypes. Here again I would like to say that these fat cells, they have the potentiality of having stem cells within them, and they can be utilized to work as stem cells. Then these Visceral obesity will produce mitochondrial dysfunction. Then there could be inflammasome activation. Then there is epigenetic alterations in which there is oxidative stress, there is cellular senescence or paracrine senescence. I did talk about changes in gut microbiome and the permeability of the intestinal wall, chronic infections, intrinsic immune cell defects. All these taken together will lead to inflammaging. So the potential mechanisms, and out of all of them, obesity becomes very important. I did talk about gut microbiome. I will not go into the details. I have already talked about obesity. It is a major influence on adipose tissue because adipocytes keep on hypertrophying. Now this low-grade inflammation, the metabolic factors, it turns into a metabolic syndrome, and this metabolic syndrome is a cluster of conditions occurring together with increasing risk of developing type 2 diabetes, heart attack, heart disease and stroke, one or all of them. Well, anemia, cardiovascular diseases, sarcopenia, osteoporosis, chronic kidney disease, diabetes mellitus, cancer, depression, dementia, all these can evolve out of this. Now see, when inflammaging has set in, what are the kind of changes? If you start from one end, it is cardiovascular disease, type 2 diabetes mellitus, chronic kidney disease, cancer, depression, dementia, in orthopedics, sarcopenia and osteopenia, and definitely anemia. Overall, what we get, multimorbidity, will lead to physical disability, will lead to cognitive disability, finally leading to frailty and premature mortality. I will not go into all the details. I have talked about them, and this is a master chart where we can see how anemia takes place, how osteoporosis takes place, how sarcopenia takes place, how neurogenesis takes place, how insulin resistance takes place, mitochondrial dysfunction and biogenesis takes place, and friends, the stimuli of damaged cell debris, irritant chemicals, pathogens, intrinsic cell defect, they all set in the process of inflammation, which finally eliminates cause of inflammation with resultant switch off inflammation and the healing process. Is there a solution, or I have only come to talk about the process of inflammaging? Definitely, if we want to live longer, Dr. O.P. Sharma had also talked about some of the drugs which can produce longevity. So, increasing life expectancy could be there. So, healthy life expectancy not increasing at the same pace as life expectancy is increasing. So, we have more years being lived in poor health. So, what are the solution? One drug that we all should remember is rapamycin. Rapamycin is available in India, is costly outside India but not very costly here. They are the zero protectors capable of slowing the aging process. It has been approved for anti-cancer therapy, for rejection prophylaxis after organ transplantation, drug-eluting coronary stents also they are used, lymphangioliomyomatosis and tuberous sclerosis. If rapamycin plus vaccination against influenza, which was talked in earlier paper, it boosts immune response by reversing immunosenescence. Now, in short, the longevity solutions could be one, rapamycin, number two, aspirin. So there was a question if aspirin should be taken or not. If not contraindicated, it should be taken even as a longevity medicine. Well, metformin Many of the early patients of diabetes keep on coming to us. नहीं डॉक्टर साहब मेरा तो कुछ कुछ करके ये जड़ी खाता हूँ वो बूटी खाता हूँ और कंट्रोल होता है. I always say it can make you live longer. Take even a minimal dose of metformin. And friends, I have talked about gut microbiota. So if fecal microtransplantation is done, it prevents gut dysbiosis and can also make you live longer. So the hypothesis can be turned into clinical practice, and this way we can have remedies to live longer. Thank you very much.
Thank you very much, Dr. Jha. If we can take one or two questions.
Sir, you can ask a question or comment and then we'll proceed.
Can you comment on rapamycin, please? Doses
Right.
and
Oh yes,
how frequent?
rapamycin, various doses are prescribed. The safest one is 1 milligram per day. Sometimes 6 milligrams for 4 days a week could also be there. So rapamycin is a drug which can safely be prescribed, but during the initial prescription weeks, the patient must be under observation.
Thank you, sir. I think if any question is there, we can discuss it later during our lunch time. Thank you, sir.
Against this guy, not against Titlis.
We would also like to present a green welcome to our esteemed chairpersons.